This is the skills validation for IV therapy. Today we're going to be going over spiking and priming a new IV bag and getting that set up for the patient. So we do have a physician's order to do this today. Usually I would be doing this away from the patient's bedside to get it all set up first. So we can open the new IV solution. We want to check this bag, make sure that there's no leaks, there's no holes in it. It is clear, not cloudy, and there's no particles in that, so it looks good. We also want to make sure that we keep the cap on this end part until we're going to use that. That is a sterile part of this procedure. So we'll do our first check first. I do have a MAR. So we have 0.9% sodium chloride via IV to infuse at 100 milliliters per hour for our patient Robert Reed. And that is correct, 0.9% sodium chloride. And then we can get the tubing out, and we'll get that set up. For the tubing, the sterile parts of this are these two parts here that do have the caps on. So we will leave those caps on until we're ready to use them. And we do want to have this clamp closed. So we'll put that the whole way down. Okay, and this is when we would remove the ends for both of these for the spike and get that onto the IV bag. And we can go ahead and fill or hang our IV bag. So we do still have this clamp closed for right now, and we're just going to fill up our drip chamber. So we'll squeeze that until it's about half full. Okay, and now we'll open the clamp just about halfway to start letting the fluid from in the drip chamber into the tubing. And then we'll close that back up. And we just want to check the tubing to make sure that there's no air pockets in there. And that looks good. We do still have the cap on this to keep this part sterile. All right, And now we'll move to the patient's bedside. We do want to do our first 5 here. So I would introduce myself and identify the patient. Hi, I'm Samantha. I'm going to be your nurse today. We received an order for your physician to change your IV solution and get that running for you. I'll make sure that you're safe the whole time, and I'm going to pull the curtain for privacy. Can you please tell me your name and date of birth? Okay, Mr. Reed, and do you have any allergies? I do see that you're allergic to sulfa. Okay, thank you. And I would, of course, wash my hands. And this is where we would do our third check. So we have Miss Robert Reed, 0.9% sodium chloride IV at 100 milliliters per hour. Okay. Yep. And we'll don a pair of clean gloves. We do want to assess this IV site. So we're assessing for phlebitis. That would be the presence of any redness, any pain, any warmth. We do want to ask the patient if they're experiencing any pain in their IV site. And we're also going to look for infiltration. So any leakage, it may be cool, there may be paler, and there may be swelling. We might also see a cord in the vein and see that as well with infiltration. So I don't see anything. The site does look good. We want to flush this out with our saline before we start the new bag. So to get all of the air bubbles out of our saline syringe, we can prime that first. Just by hitting that, getting the air bubbles out. And we also want to make sure that we have washed the port on the extension where we're going to be connecting this. So we just have an alcohol swab and we're cleaning that with the alcohol swab. If before we connected the syringe, we had to put that port down again, we would want to wash it again, because at that point it did become contaminated. So we do just want to be mindful of that. And since this is a shorter IV line, peripheral IV line, we can just rinse that with 3 to 5 milliliters of the solution. We're going to inject that slowly and steadily. Okay, and now is when we would get our IV, or our tubing for our IV on there. We do just want to wash the site again, the port, with our alcohol swab. making sure that this part of the tubing does stay sterile. We're going to connect. And we would open the clamp, set our IV pump, so we're doing 100 milliliters per hour, and we would set that, and then the pump takes care of that rate. We do want to continue to assess the site and assess our patient for any pain at least every hour.